Hi, I'm Dr. Senthamizhan, General Surgeon from Athreya Hospital. I'll be discussing about a topic known as laparotomy. What is laparotomy? Opening your abdomen in the midline to show that having an inevitable access to all the part of your abdomen organ is known as laparotomy. Patient should not have why the confusion regarding why the laparotomy and when the laparotomy has to be done. First, I will just let you know why the laparotomy is done. Laparotomy is a very critical procedure which will be done almost always in a critically ill patient. Laparotomy is done in a few conditions known as patient who are suffering from the blunt trauma to an abdomen, because the injury to extent of what and all organ is involved, we have to be examined, where a thorough and proper examination of all the organ has to be done. Second thing is, if any prolonged infection even after proper treatment also it is not subsiding, or any stab injuries happened, we don't know what and all organ has been involved, in those conditions laparotomy is done. The major purpose of the laparotomy is done to examine the abdomen properly, so that the chance of redoing surgery is very less in the patient, and it is always act as a life saving procedure in certain patient who are having an too much infection of the intra-abdomen. Putting an infection and draining the pus out of the abdomen is going to almost save the life of the patient. Laparotomy is indicated as an emergency surgery only needed when a patient is having an emergency purpose of the laparotomy. The most common condition where a patient will be having laparotomy are blunt trauma or any abdominal perforation, even in a perforation of vital organs like appendix, liver, spleen. In those conditions, when the organ is just shattered, when to get an hemodynamically stable and faster recovery, laparotomy will be done. Laparotomy is done, I already explained, laparotomy is always done as an emergency surgical procedure. Even though it is an emergency surgical procedure, a proper pre-operative evaluation always help in the faster recovery of the patient, whatever surgery is patient undergoing. What is the proper pre-operative investigation, that the pre-operative assessment has been done? First thing is patient vital, whether the patient is perfectly stable or not. If patient is not stable before the surgery also, patient has to be stabilized at least to an extent, so that the patient is able to tolerate such a huge surgery for them. The proper pre-operative, if the patient is fit enough or it is stable enough to go through other investigation like a cardiac evaluation or lungs evaluation or the other vital or evaluation, patient can go through that. Or in a mere unstable patient, this kind of proper evaluation is not required, because laparotomy is always going to be a life-saving procedure. But post surgery, patient has to be, once the etiology for causing that this much hemodynamic instability in patient is treated and it is removed, patient has to be treated or evaluated even in the post surgical patient has to be going to be regular physical evaluation by the operator doctor, even investigation needed like blood investigation, or if any CT scan or scan is needed, so that whether the surgery which has been carried on the patient for the purpose of what it has been carried has given a patient or any benefit or not. It's going to be detected by post-operative evaluation like simple blood investigation or routine scans or routine blood investigation will help in the post-surgical evaluation. Third thing is recovery. As I already told, it's in an emergency surgery. In an emergency surgery, the recovery is not going to be as smooth as a surgery which has been done as an elective basis. Elective basis means as planned and done in. Since the patient has been in emergency, even his physical state will not be in a proper state. So post surgery, patient has to be kept evaluated properly, and treatment has to be given properly according to the state of the patient. If patient is needing any mechanical ventilation in very infected patient, even those things has to be revolved. Post surgery, when the patient has recovered well and is able to take in the normal oral diet, and the patient should be explained about what surgery he has undergone, and has to be explained what under precaution he has to be taken care, so that he is able to avoid the complication which is going to occur because of the surgery. One of the most common complication is wound infection. Since the wound has been opened and the wound, it's such a large wound which is almost run from the upper part of your abdomen to the lower part of the abdomen, so the wound healing is going to play a major role. Like Even in the initial stage, patient should be taking care of having a proper diet, proper proteinaceous diet, keeping himself clean, and regular dressing from the doctor side will help in this thing. Post, once the wound is healed, patient should also be aware of the avoiding weightlifting. Since almost a whole part of his abdomen is open, even there is a huge chance of patient developing hernia in future is going to be present in him. So how to avoid is wearing a proper abdomen belt almost for an year will reduce the chance of hernia formation. It's not going to completely neglect the chance, it's going to reduce the chance of umbilical hernia appearing even in later age. Third thing is during the initial part of the surgeries, initial days, patient can have infection, pain, and patient can have some infection which is transferred from the local abdomen area into blood. These and all will be taken care as a treating doctor will go through those, and he will give a proper treatment which will almost most of the time will put you out of these troubles. As a patient side, post surgery, having a proper diet, taking care of yourselves by but not lifting heavy weight, these are the few things which help in the early recovery. Third thing of the early recovery is early mobilization, always going to help you in the early recovery. There are few complications which are going to happen which is unavoidable in the surgery. The first complication is wound infection and wound adhesion. Any of the abdomen has been opened as a whole, and somehow even with the proper antibiotic treatment, wound is going to be getting infected. Since it's such a large wound adhesions can be happen. Both of these wound infection, wound adhesion can be treated properly and can be healed with the proper medication only. Second thing is oral diet. Since the patient had underwent a large surgery, and in most of the patient a part of the intestine can be removed, so in those cases patient will be started initially in the clear liquid. Maybe patient will be kept in the only in the liquid diet for a prolonged period of the time. Since if the patient is not able to take proper diet even after 7 days, patient may be needing an external nutrition in installation to the patient in the form of TPN. TPN is nothing but the nutrition which is needed for the patient for a particular day can be given through an IVSS. It is known as total parenteral nutrition. Parenteral means nutrition which is given to a patient other than oral route. This will be required in most of the patient if the patient recovery is not in the smooth way. Post recovery, when the patient is having an evidence of getting infection or the infection is going to be prolonged period of time, patient will have to be kept in the prolonged antibiotic cover, which is going to give you different complication like maybe your kidney will not be functioning properly. In those cases, even very few patients, when the kidney is infected too much because of the abdominal infection, even patient can be required dialysis. If the infection has spread to the lungs, patient can be required higher antibiotic along with that ventilator support also. But if the infection and all the condition has been get rid out of your body, things can come into normal range regularly by a proper monitoring from the patient. Post recovery, when the patient has been discharged and patient is able to carry out his normal work, first thing patient has to be conscious is he should understand that he has undergone such a big procedure or such a devastating procedure which has almost endangered his life, but with the proper treatment he is back to his life. So proper diet will play a major role. Proper physical activity, regular mobilization with regular physical activity and regular exercise. Third thing is avoiding weightlifting and wearing the abdomen bandage. These are the few precautions which patient has to take post surgery so that he will avoid the complication which can be avoided because of this surgery.